one of the general surgery chief residents here at Harbor-UCLA Medical Center. I'm so excited for you to take a tour of our amazing program today. The first stop is in the atrium of the building that's right behind me, so come along.
Hey, I'm Ian. I'm a Gen Surg categorical here at Harbor.
And I'm Gina. I'm also a Gen Surg intern here at Harbor.
We are in the atrium right now. If we go this way and into the elevator, up there is the surgical ICU.
And over here is the emergency department and the trauma bay.
Hey, we're filming.
Ian, it's our seniors.
Oh my gosh, I'm so sorry. I didn't
What are you guys
recognize
filming
that.
right now?
We're filming a promotional video for the program.
Oh, that's awesome. I love Harbor. What's your favorite part about Harbor?
I also love Harbor. My favorite part about being here has to be the patients. It's just such a privilege to take care of them, and they are really appreciative of everything we do.
And I think that caring for this population draws people who are invested in service and really excited about creating community. TTA2 in the trauma bay.
All right, let's go.
Hi, everyone. I'm Catherine.
My name's Dwayne, and we're both second-year general surgery residents here at Harbor-UCLA.
We're a level 1 trauma center in South Los Angeles, meaning we see about 4,000 traumas every year.
And as a trauma junior on call, that translates to 15 to 30 traumas and non-trauma consults in a 24-hour period.
Hey, come on in. Welcome to the trauma bay. This is where all the magic happens. Lots of supportive and high-pressure learning goes on here. We do a lot of procedures on our patients, like resuscitative thoracotomies, emergency chest tubes, and central lines. What's up, Katrina?
Hey, in addition to those procedures, as trauma chief, we're expected to be leaders for our team. We take our juniors through lap choles, lap appendectomies, and colectomies.
Hi, welcome to our ORs. I'm Jillian Angela. I'm one of the chief residents of surgery here.
I'm going to head to the SIB center real quick.
She's kidding. This is OR 4. This is our trauma surgery red room. It's fully staffed and ready to go at a moment's notice for any trauma that'll come in.
Courtesy of our excellent OR staff.
But really, our operative volume here is so high that our sim training really comes secondary to our on-the-job experience.
Right here, we're in OR 12, where our Da Vinci Xi dual console lives. So here at Harbor, we have a structured robotic curriculum through Intuitive that allows us to track data from each of the cases we participate in, as well as achieve our robotic certification by the time we graduate. So we use it on our colorectal service, we use it in our surgical oncology service, and our MIS and bariatric services.
Our beautiful surgical ICU, which is where we're located, which when I interviewed here, one of the most memorable parts of the tour was coming through this ICU because kind of the controlled chaos I was looking for. And so as second-year residents here, we spend a ton of time in this ICU and really get to run it.
As a trauma hospital, it is not only a surgical critical care intensive care unit, but also a trauma ICU where we're able to provide the top level of care for all of our patients.
You are operating as an intern, operating as a very junior resident. As early as your second and third year, you're starting to have leadership roles where you are taking other residents through operations or procedures. And then certainly as a chief resident, you are almost a junior faculty member at points, running your service. And I think there's a lot of value in that, transitioning from residency to post-residency.
The population of the patients at Harbor is incredibly diverse. It's diverse socially and economically, racially. The result of that is that you get a group of people that ultimately usually need care that couldn't get it elsewhere. The result of that is the patients that get cared for here are very grateful, very trusting. It's great for a trainee because you are the patient's doctor, and that makes for an extremely valuable learning experience.
A lot of our patients, you're the first doctor they've ever seen in their life, or for most of their life. You're dealing with a lot of new discoveries in their health, a lot of comorbidities, and in the surgery team, you're also dealing with their surgical emergencies. And so as a new intern coming in, you have to be ready to tackle diabetes, heart failure, AFib, COPD, in addition to their acute cholecystitis and having to take out their gallbladder.
We serve people that come from disadvantaged backgrounds, who are experiencing homelessness, who are incarcerated. Some of these people have been turned away by other hospitals and they have no one, and so they have to come to us. it's really powerful to be able to take care of these people and just see how much you're able to help them. And I think what's more important is that those interactions and the care that you're able to give those patients and how they're able to pull through, it really teaches you how to be a better human being, not just a better doctor and a better surgeon.
We really have a high expectation in terms of the level of doctors that the residents come out of the program being. And so there's lots of hands-on learning and lots of opportunities from a very early stage to get involved in the operating room and making critical care decisions for our patients.
This is a really unique place. We have this ability to be true clinician educators. We can really let our residents be full-fledged surgeons and full-fledged doctors. And I have the luxury of being able to train residents and then let my chief residents run their services. And I really trust them to do the right thing. I'm here to support them and supervise them and teach them. But the thing that's amazing about our program is that we really can let our senior and chief residents run the service.
I came to Harbor-UCLA as a student, and the word back then, even at UCLA, was that if you really wanted to learn surgery, if you wanted to be surrounded by great educators, residents and faculty, Harbor-UCLA was the place to be. And so we pride ourselves in the fact that we take education of our residents, that responsibility, very seriously. We provide what I feel is an exceptional opportunity to give residents greater autonomy and the ability to take care of very complex patients, and at the same time grow as a surgeon to become what I feel is someone who is highly competent to be able to go out and do really whatever they want in their career, whether it's an academic career, an educational career, or going to practice.
It's hard not to be on call with people working for 24 hours at a time and not to get to know them at a personal level. And so by the time you're a graduate, we're close family, friends. You sometimes spend more time in residency than you do at home. So to not know these people intimately is impossible.
I'm never upset about coming to work and hanging out with the people I work with, which makes it much easier to do the long hours and the late nights.
I haven't had a single time when I felt that I didn't belong here, that I wasn't supported here, and that I couldn't reach out to anyone really to let them know if I was going through something and I needed to talk about it.
I've never really felt as supported in my med school career as I do with my co-residents. They're always kind of pushing me and understand kind of the struggles and nuances of this hospital compared to other hospital systems, and they're always fighting to make sure that we get great education and get great operating time, and there's never a fight for procedures or anything like that, and I think that's really rare.
The Lundquist Institute is a world-renowned research institute that's located right on our campus. So that is a great thing for the residents, because this means that residents have the opportunity to make use of all that the Lundquist Institute has to offer.
Our residents and our faculty are very committed to providing the most recent research, and many of our faculty are very engaged in both clinical and some basic science research, and I think that's vitally important to always be offering first-rate, up-to-date care. And our residents are regularly presenting at regional and national meetings and publishing in top-rated journals. And I think that's an important part of our residency training, not just for their training, but then for their career as they go ahead.
I was born and raised in a small town in Alaska on an island, and part of what I was looking for a surgical program was something that would prepare me, if I chose to go back and practice by myself and be confident that I could practice without, a big surgical group that could assist me. And so the operative experience we get here at Harbor, I felt really would prepare me if I decided to return to Alaska and be, one of two general surgeons in a very small town.
I like LA. I would like to stay, but I've really made a big commitment, a vow to go back to the Central Valley. So the good thing is I'm not too far away. And the other thing I like about being at least somewhat close to LA is that when I go back to the Central Valley, a lot of the connections that I've made here in Los Angeles would help the patients that I hope to serve in the Central Valley.
I mean, Los Angeles has so many perks. It's starting with the weather. It's great weather most of the time around. We're close to really beautiful locations like Manhattan Beach, Redondo Beach. I think one of the most recent things I started doing was biking on the Strand, and going from here to Venice Beach is just so nice and so pleasant. It's a great way to de-stress.
I love the outdoors, and an hour away from most places in LA. You can go hiking, you can go, I mean, like some of our residents go scuba diving, they go surfing. Like I live a 10-minute walk away from the beach, and so like that Post Falls is really, really nice.
We're looking for people who really have a drive to learn. They have to be hard workers and have to usually have a dedication to helping the community at large.
I would say as long as you have heart and compassion for our patients, it'll take you a long way in our program.
You got to trust the process, whether that is the interview process, the residency process.
This is a very supportive environment. You get a lot of assistance, but a lot of autonomy at the same time. You're never on your own. Somebody is always there to help you. And the most important thing that you can learn is just to ask for help.
To succeed as an incoming resident, you really have to find your best fit. And if you find a place with good people, I think that's really important. And if you want to learn how to operate, and you want to learn how to operate from amazing, incredible teachers that are also good people, I think you should come here.
This is a really special place. People talk about the Harbor mystique. We take care of each other, we work hard. It can be totally crazy and overwhelming, but also wonderful. And it's definitely worth it.
Thank you for your interest in Harbor-UCLA. We are so proud of our current residents and graduates. We look forward to meeting you and finding the next group of dedicated and unique individuals to join our Harbor family.
Dr. Neville has some great socks, and a lot of our graduating residents will gift her socks at the end, and she holds on to them for dear life. So
Dr. Neville's socks say a lot on what she's feeling on any given day, and they're always impressive and funny, so it's definitely worth checking out.
They're always seasonal too. So she has Christmas socks, she has Valentine socks. If you're on call with her on the holidays, she'll definitely wear them.
Yeah, Dr. Neville's socks are really funny.
She has very sassy socks. Like one of the other days, she just says she had socks that are just I just can't care enough. But just they're a lot of really funny socks.